take a look at some of your medical devices, your balloon pumps, some of your IV pumps. Look on the back. There's many ports on back of those. Think of laptops. You know, are those all open access or are they shut down? You can have programs or put, something in there to stop people from accessing it. And many times they're not. Now, all it takes is somebody to walk into a room with a jump drive, go into the back of a medical device and insert, let's say, that jump drive in, and they can actually alter the treatment for a patient or expose our entire health system or health network to vulnerabilities. This can actually cause a malfunction. And keep in mind, we've also had patients that have actually hacked their own pumps. And medical devices aren't just pumps, they're balloon pumps, they're, pulse ox machines, anything, when you think of smart devices. So I wanted to call your attention to this picture. This on the left-hand side is your typical medical intensive care room, lots of devices. We see somebody's ventilated. You see 3 stacks of IV cartridges. So a lot of different potentials here for actual compromise to occur. So go into your patient rooms and see what's happening in the back of those machines. Maybe you have a hard drive because you have a computer on wheels or, a charting station within the room. I bet you those devices are not secured. But let's take a look at this other picture here on the left-hand side. This looks like a pretty benign room. This is actually a pediatric room, quite beautiful, lovely colors. But what I'm noticing here is there's actually one device that people forget that can actually be hacked. Does anybody have an idea what that might be? The bed, we have that. That's a good one. Anything else? Say again. IV pump, yes, that's very good, but there's also another one. It's actually that smart TV in the room. You can access the network through smart TV, through that smart TV, and you can access the camera. You can get into the network. So people actually forget about these smart TVs. So medical devices are often used for medjackings are often done. It's where you use a medical device by hijacking it with intent to harm a patient. But what do you do if you actually see signs of medical device breach? What would you do? What does it look like? I don't think we teach people on that, what to do. We implicitly look at a medical device and pretty much trust the data that we see on it. Well, what if you see things like you have windows that have been opened up that weren't there before? What if the pump has a glitch, it turns on and off? What if it freezes, shuts down, or you have some new files loaded? Those could be signs of a medical device breach, and they actually have been. There's actually no states right now that currently make it mandatory, CNEs, for states that offer cybersecurity training or informatics training and PHI. We don't even learn this in medical school or in nursing school. We're starting to bring that forward, but that's just not a requirement. I also want to bring to your attention a case that's in the literature, a study by Dr. Tulian Damoff from the University of San Diego in the year 2017. They did a real-life high-fidelity simulation of actually a cyber attack on a patient, and they simulated the patient. They brought in an actor, and then when it was time to do chest compressions, things like that, they went to the high-fidelity dummy. But what was interesting is all the healthcare workers went through helping the patient, per the scenario, a stroke, a misfired pacemaker, but never in the end, they couldn't figure out in the end why were there things like this patient kept getting over-bolused and what they were doing to help and save a patient wasn't working. Well, that's because the medical device was hacked and compromised in each of those situations. So what was very interesting is at the end of the scenario, some patients lived, some patients didn't, but at the end of the scenario, none of the clinicians, especially the physician, had no idea to factor in a differential diagnosis of a medical device hack. So it's not something that we learned in school. It's not something we think of. So hopefully, when we design our cybersecurity governance strategies, which I'll talk about, we factor that in. So a couple things, what's the best course of action when working with medical devices? Well, that's to stay informed about updates to the medical devices. The U.S. Food and Drug Administration has information on medical devices. So does NIST, the National Institute for Standards and Technology. And there is actually a medical device NIST standard, that's SP 1800, that you can get more information on. I also, and so do other folks within cybersecurity sector, would like to see folks register those medical devices and especially wearables with the manufacturer. The manufacturer is required to let us know if there's cybersecurity vulnerabilities or if there's updates and patches that need to occur. So one other technology that is coming into play now is 5G cellular technology. That's the 5th generation of wireless technology. 5G has many, many promises for faster communication, less latency. But with 5G, there's like 200 more connection access points, security points, that there could be points of failure. With 5G, it takes lots of third-party hardware and software to build and run. So you have much more points that can be accessed. And about 80% of cybersecurity risk management leaders agree that implementing 5G can lead to cyber threats. Also remember, with 5G, it promises so much, but if any of the legacy vulnerabilities were not fixed in 4G, they come right on over into 5G. We talk a lot about the zero trust model. No person, no device should be guaranteed access until first they're authenticated and verified. So you'll see a bit of that. And multi-factor authentication is such a key when working with 5G and all these different devices. It's so important to use those portals. I want to just briefly touch upon teleworking. That is something we're doing much more because now we are working remotely from home, especially with COVID, and you still might go into the office a bit, but I actually see this quite a bit. I work with nurse practitioners and medical records folks. Even though I deal with financial data, I see many people still do not want to get onto the VPN. Oh, it's too hard, it takes too long, I can't remember my password. Wow, what a great way to access the network. Many patient portals can be accessed by breaking into your password, getting your passwords, and that has been done. If you look up rainbow tables, just somebody who's non-technical can show you how to break into somebody's password and break into those portals as well. So the other thing is, do our employees know where to report or who to report when there's suspicious cybersecurity activity? Probably about 90% of those calls would come through the help desk, but we have some people that just said, oh, that's a glitch, and they don't think much about it. I also wanted to talk about social media and healthcare. Using social media isn't without risks because there are no guidelines for social media. We put a lot of information out there, personal facts. If you're on social media, your dog's name, where you went to school, your best friend, all these things could be data mined for criminals when they want to utilize the internet to glean data, personal data to personally, to maybe have an attack by stealing your password, because a lot of times we reuse that data into our passwords. Also, we have to keep in mind that a lot of times where research is done on social media, things like online surveys and patient-reported data, there is no requirement or guideline for how subjects are recruited or given consent. I do see a lot of folks send their patients to a certain website. Look at this website, put this information on. You can use this for drug information comparison. And people don't realize, especially those consumers, that sometimes that data that they put in there, that can be harvested by, a cyber criminal, and they can, gain insight into that person's information. So I just caution folks when I say that, when I see a lot of people sending folks to certain websites. Now, there is actually an ISO standard for healthcare apps, and that's standard 82304-2 was updated in 2021. You can find out more on the ISO website if you'd like to on that. So what's our best way to keep our patients, ourselves, an organization safe? Well, that's through good cybersecurity governance. Cybersecurity governance is that three-pronged approach of our applications, our users, and our infrastructure. It also looks at our organizational structure and our work culture and our culture of safety. How often do we take cybersecurity training? Is it just once a year? Is it just once every quarter? Also, I was so pleased that we were able to speak after that wonderful discussion on downtime. And it sure sounds like nursing is really leading the way with downtime. So we have downtime champions, but how about champions for calculations? You know, who do we go for to drug calculations? We work with critical care, ICU patients, pediatric intensive care, NICU. These are, you know, you've got to get your dosages just right. The American Hospital Association actually recommends that you have downtime champions, but also champions of drug calculations as well.